Pregnancy is a normal life event. However, this is a period in which a woman is more exposed and vulnerable to a significant amount of stress and anxiety. Like any other person, rich or poor, all women have fears with many unanswered questions. Like,
can I keep all about this pregnancy? What if I die during the abortion? I'm only 16 years. My boyfriend abandoned me with this pregnancy. How will I tell my father? How will I survive with this pregnancy? Where am I going to stay with this pregnancy?
Won't this pregnancy interfere with my career? I have 3 girls so far, and my in-laws are demanding for a baby boy. My husband sides with them. Will this pregnancy survive this tension?
What if I get COVID-19? Will I survive? Where will I get a mama kit? Will Pastor work on me if I don't have it?
Who will support me at the time of delivery? Will I deliver normally or will I be operated? And if I'm operated, who will take care of me?
due to all these, they are at a higher risk of mental disorders.
Globally, 1 in 10 pregnant women experience mental health disorders, with depression being the commonest.
Depression can progress to the postpartum period or even result in postpartum psychosis, which is a psychiatric emergency.
Despite all this, mental health among pregnant women in Uganda is still a neglected public health concern.
Antenatal care is an avenue for mental health assessment of pregnant women, but due to the overwhelming numbers, this has been given less priority. Health workers now focus more on the physical well-being of mothers and the unborn child in a bid to cope with an already constrained healthcare system. This has gone on for far too long, and it is now time to act.
Pregnant women experiencing any form of stress or anxiety should openly express their concerns to their significant other or a health worker.
Partners should support pregnant women in all aspects, both emotionally, economically, before, during, and after childbirth.
Communities should not emotionally abuse pregnant women.
Healthcare providers should create and sustain an enabling environment to address the mental health care needs of pregnant women.
We keep talking about the 10-point interventions for mental health in pregnancy. And when we talk about that, the key things that should be priority. 1 should be the woman herself. She needs self-care in order for her to address the key concerns. The second thing is the husband. The husband needs to take total responsibility. The next thing, which is the third thing, is the community or the family. The family should provide support. Then we go into the community. In the community, we've gotten teachers. Teachers should educate. We've gotten churches. We've gotten mosques. Those should again inform these women as far as, and the community as far as mental health and pregnancy is concerned. Then we've gotten the different entities that exist in there, from the chiefs to the local councils. Still, the role of the local council that would be very key is to be alert when it comes to mental health in pregnancy in these settings. Last but important, it is the ministries, especially the Ministry of Health. That one should set policies and guidelines that are inclusive of mental health in pregnancy. They should be able to recruit midwives, nurses, doctors that have gotten experience in mental health in pregnancy. As well, they should provide enough supplies and drugs appropriate for handling mental health in pregnancy. The other thing which we keep always forgetting in these settings is linkage. We want the Ministry of Health to ensure that the clinics for mental health directly link into our antenatal, postnatal, most of the Department of Obstetrics. One way of doing that, we would encourage the government is to set up standalone mental health clinics within this department.